Welcome back. Welcome back to HIP, Health Insurance Personalized. This is Consumers Doctor on the behalf of Foremost Organization. Today's topic is impaired health support plans, which essentially help helping the sickest among us, folks. Helping the sickest among us. This is the challenge. Impaired health support plans will provide a maximum help and support to the most in need. Every beneficial service, assistance, and plan designs are available to those with chronic and persistent illnesses, folks. Chronic and persistent illnesses. It is hard to know how many people are truly uninsurable. But there is an ample evidence that the number and the cost are much smaller than previously assumed. Than previously assumed. Obamacare proved the number of uninsurable individuals to be lower than expected. It proved to be lower than expected. Included in Obamacare was a 3.5-year transitional program known as pre-existing conditions, pre-existing condition insurance plans, so-called PCIP, pre-existing condition insurance plan, PCIP, launched in the summer of 2010. And Obamacare appropriated $5 billion to finance the program. 3 years later, by April 30th of 2013, just 110,298 individuals were enrolled in so-called pre-existing condition insurance plan. That's all the number. Only a small number of them were enrolled into that pre-existing insurance plan. A Kaiser Foundation study in 2011 showed the uninsured, so-called uninsured, as a percentage of individual market to be around 2.2%, folks. That's all, 2.2%. The individual market is only 5% of the population. Individuals market is only 5% of the population. Based on this and the other data, they estimated uninsurables, so-called uninsurables, could amount to less than 1% of the total privately insured population. Less than 1% of the total privately insured population. This is consistent with previously described percentage of catastrophic impaired risk. This is consistent with that, catastrophic impaired risk. So before Obamacare, the uninsured were dismissed into state-run high-risk pools, so-called high-risk pools. Those pools were limited in benefits and had high premiums, folks, and had high premiums. They provided little to no informational or clinical support for those who were the sickest and the most in need of the support. Those are the people most in need of the support. Personalized health insurance reverses that approach. Reverses that approach. Impaired health support plans, so called impaired health support plans, are designed to provide maximum help and support those most in need. That's what the whole concept is. Those are the people we need to focus on. Every beneficial service and assistance will be available to those with chronic and persistent illnesses, folks. This is where we need to focus our attention. We can't just generalize everything. We need to focus on the people who are uninsured, people who really need the most care with chronic illnesses. So, what does the impaired health support plans do? They will provide all the health management, condition management, health literacy, and decision support programs, account based options, and incentives available under most of the self insured group plans. Incentives available under the most self insured, so called HSAs, group plans. All plans will include focused wellness, recovery, and disease management programs, folks, and disease management programs. The plans will include medical and information support for all specific, chronic, and persistent health issues. Those are the folks. Persistent health issues. Personalized health insurance assures unique coverage for the best care and treatments for the sickest among us, folks. For the sickest among us. This is where we need to focus on. We cannot say just one size fits all will take care. We need to focus who need the most care, and we need to support these individuals. It is the individual lives, including those segmented from the small groups, like small mom and pop businesses. They are segmented from, some of those were segmented from the small employer groups. Because if one family member is sick, they can be segmented. So the rest of the folks could have a regular premium. So people in the family, one person is sick, they're segmented into the impaired health support plan, and they'll be granted access to that particular who's impaired, and they will provide impaired health support plan even in smaller groups and individual policies. Now, here is the twist, folks. Here is the twist. The impaired health support plans will be group plans, will be group plans rather than individual policies. I hope you're getting it. It's a group plan. These are all under the one umbrella. There will be multiple plan options available, but each option will be under a group contract. Will be under a group contract. This is a profound, critically important difference from the old high risk pools. I hope you got it. They're critically important difference from the older higher risk pools. These groups, impaired health support groups, internal to their operations, company operations, insurers or insurance companies typically segment the individual and group management and administration. The group operations are generally more robust in providing medical and information support programs. Medical and information support programs. Group plans offer more favorable coverages, increased medical support, and lower premiums than individual policies, folks, than individual policies. Group operations typically have better third-party contracts. Group operations typically have better third-party contracts and broader and lower cost provider network. To take advantage of these options, personalized health insurance enrolls impaired health participants in specially designed group plans than individual policies. Folks. This is the way impaired health support plans work, folks. This is the beauty. This is where we need to focus our attention. And if you really look at, less than 1% of the population, we need to focus our attention to. And this will go a long way, folks. We don't need to, raise the premiums and rest of the entire population. We can go by the segmentation. Segmentation. When people are segmented, the pre-existing illnesses are covered, folks, are covered. And they will be given a special importance. Focus on these people, either economic or physically impaired. Doesn't matter. If they're economically impaired group plans, they will get economic assistance. But they're physically, mentally impaired, they will be given a impaired health support plans under a group. And the insurers will love to see those groups being handled, so that way they will also benefit. So insurance companies will benefit too. Thank you for joining and thank you for listening. I love you guys. We'll see you in the next episode. This is Consumers Doctor from HIP on behalf of Foremost Organization. We will see you. Goodbye and salute.